Surgery is always a last resort, really, for any patient. And so when trying to decide who should be your surgeon, you should be going someplace that offers you the full range of treatments, not only surgery, but non-operative treatments. My name is Dr. Mark B. Kerner. I'm an orthopedic spine surgeon. I grew up in New York. I went to medical school at the Albert Einstein College of Medicine and did my residency in orthopedic surgery there, followed by a fellowship in spine surgery at the San Francisco Spine Institute. I've been in practice here for the past 25 years. When you're my patient, you're what's most important to me, and I have no other interests other than your well-being. I found orthopedic spine surgery fascinating. It impacted patients greatly in terms of their quality of life, their ability to work and function. The problems that we were dealing with in orthopedic spine surgery can be life-threatening and career-threatening. And for a lot of patients, it's a very scary time. The concept of spine surgery reasonably worries them. I decided to come to practice at HROSM because you can on-site obtain diagnostic studies, x-rays, MRIs, you can obtain your physical therapy all in one spot. And if it should be that surgery is necessary, you'll be taken care of by some of the most notable surgeons in the region. Coming to HROSM for your evaluation and treatment is a good choice for a patient in that they won't feel like they're being steered to something. They're being given a series of options and could pick from the best that's available. I offer patients a full range of spine surgeries, whether they are small surgeries, we call decompressions or laminectomies, to major orthopedic reconstructions in the cervical, thoracic, or lumbar spines. What you're really trusting is the expertise of your physician to lead you through this difficult time, try to figure out what's best treated non-operatively or operatively, and then within the range of surgeries, what's the right surgery for you. There are lots of surgeries out there that I do, disc replacements, various fusions in the cervical, thoracic, and lumbar spine. I do these surgeries generally in the least invasive way possible, so we use smaller cuts for a faster recovery and shorter times in the hospital. And what I can offer you is my expertise and experience in these matters. It's not only the surgery, but it's the aftercare. It's the physical therapy, it's the medications, it's all the other things that we have to do together as a team to get you better. It's really a collaborative effort. When a patient who's been hurting comes back and they have their life back again, it's the biggest gift you can give them. When you're hurting terribly and there's no end in sight, it's depressing, your life feels like it's crashing around you, you don't know what to do. And you're looking for a life preserver, something to bring you back to sanity. And to be able to provide them a return to their quality of life, to having their job, their family, their retirement, whatever it means to them that they're looking for, is incredibly gratifying, and it's really the best gift I can get.